So that's plan G. Now, you only have two options, really. When we're looking at it as a high level, there's only two options. It's actually pretty simple. So option one, this is a Medicare Supplement plan. They're also known as Medigap plans. Medigap plans literally just fill in the gaps of Medicare. So what are the gaps? Well, the 20%, that's a big one. The deductible in the hospital, that's another big one. Those are the gaps that they will cover for you. Now, people turning 65 this year, or even a couple of years back, basically if you were eligible for Medicare before January or since January of 2020, the best policy that you can have is a Plan G. And I want to show those to you. Plan G is the best coverage that you can have with a Medicare Supplement or a Medigap plan. It covers absolutely everything that Medicare does not cover, but it approves, except for the Part B annual deductible, which is $240 in 2024. So that's Plan G. Now, if you're older than, you got your Medicare, say, in December of 2019, I can still get you Plan F. A lot of people think it's not available anymore. It is, if you're old enough for it. Okay, so Plan F even pays the Part B deductible for you. Now your premium is going to be higher, but it is still available if that's something you want and maybe you've been working and you're now ready to get onto Medicare. If you're just turning 65, Plan G is the very best option. Now, what I mean by it pays everything that Medicare does not, as long as it's approved, Medicare has one network, one, I guess what pre-qualifier. The doctor has to be contracted with Medicare. So you go to your doctor and say, hey, doc, are you contracted with Medicare? If they say yes, they will take your supplement. They do not care what company it is. Now, if they do not take it, your supplement will not help you either because it has to have first been paid by Medicare in order for your supplement to work. So the other question is my procedure that I need done covered by Medicare? If so, your supplement will pay the balance of it. So if you have an 80% surgery, they're going to pay the other 20% because Medicare paid the first 80. If it doesn't, if that Medicare does not cover the procedure, if it's an experimental treatment, or if your doctor does not take Medicare, this will not help you. It has to be those two together. Now, the other side of things is if Medicare doesn't cover something like drugs, dental, vision, hearing, then neither will your supplement. Okay, so these are like best friends. They do everything together. They also don't do everything together. So keep that in mind as we're going through this. So one other thing I wanted to point out on this screen before we move back to our options, Plan N is the next step down. So we have F is Mac Daddy, best plan out there. Plan G, one step down, only have to pay the $240 annual deductible or whatever that is going to be next year. It will increase. This one, Plan N, exactly the same as Plan G, except you have this little asterisk. That is a $20 copay to a specialist, so anyone other than primary care. And it is also a $50 copay for the hospital. The one other thing that it adds down here is you have the possibility of being billed a Part B excess charge by a doctor or a facility. It's a 15% charge that can be billed if your doctor or your facility are not fully credentialed with Medicare. So you've got people who are completely contracted with Medicare, and they will accept payment as Medicare payment as payment in full. So you don't owe anything if you have a plan that they take in full, right? If they are not contracted over here, that's our other extreme, then your Medicare or your supplement, neither one will help you there, and you're going to pay everything 100%. This is not common. The ones right in the middle are the ones that I'm talking about. They are partially contracted with Medicare. It means that they're going to accept the money from Medicare, but they also reserve the right to bill you an extra 15%. These are the people that if you go to these kind of doctors, I'd rather you didn't get on Plan N because you will be paying that 15%. It's not common. I've actually never had one of my clients get billed that 15%, but I have to make sure that you understand that that is a possibility. The rest of these, carriers can offer these. They don't have to offer all of them. There are some that are required, some that are not. They have high deductible, say Plan G or Plan N. So when you do the one-to-one with us, we can go over and exactly find the plan that you prefer the best. So moving back, The supplements can be many different insurance companies, and they are. There's a lot of different companies that offer these. So again, we're looking at option one on the red side, the Medicare supplement option. You have Medicare. You're going to have your Medicare that you pay a premium for that each month. And by the way, that premium is going to come directly out of your Social Security check if you're getting it. If not, you're going to get a bill in the mail. Usually it's for 3 to 4 months at a time. So make sure you look at the dates when you see the large number on there that you're expected to pay. If you want to pay that each month, you need to create an account on Medicare.gov and set up auto pay from your checking account. But if you want to choose to pay the chunk at a time, you can get on Medicare.gov and pay with your credit card. So if you get points, that might be a good way to do it. Just please make sure you get that paid. I've seen way too many plans canceled because the Medicare, they've forgotten to pay. So Medicare supplement option over here. Now, these are not contracted Medicare plans. They are private insurance. They can do what they want. And the reason I mention that to you is you have an open enrollment 6 months after you turn 65, or if you've waited until, say, age 70 or whatever to get your Medicare Part B, it is 6 months from when your Medicare Part B is effective. And during this time, I can get you whatever plan you want at the best price because they're private insurance. They can do what they want. And so you see different prices across the board. Now, these also will increase every year their premium. You can count on it. So what we want to do is not just look at that starting price. We also want to look at, okay, which ones increase like this, which ones increase like this, because as our income, really gets like this in retirement, we don't want this kind of an increase. We want to be able to know what to expect. After the 6-month period, we will have to answer health questions. So if you have concerns about your health, if you have conditions that are going to be very expensive to treat, we want to make sure we get you onto one of these plans if that's what you want, right when you have your Medicare started. All right, coming back here. Now, still on the red side, almost done with this one, I promise. Medicare, separate premium, separate card for your Medicare supplement. It is called a supplement. The other side that we're going to talk about, those are not supplements in Medicare's eyes, okay? This is a supplement. When someone says supplement and it's legitimately Medicare supplement, this is what we're talking about. Plan A through N, not a Medicare Advantage plan. So you'll have a separate premium, separate card. This also, you can change throughout the year. So if you're in good health, you're able to answer the questions and maybe you get a premium increase and you're concerned about, oh my gosh, that's really increased so much. Well, if you're in good health, we can definitely shop around at any time of year because they're private insurance. We can do whatever we want, right? They are not held captive, I guess, to the Medicare rules and timelines for making changes throughout the year. Now, Medicare Part D, that's why we've got that separate card down at the bottom. Your Medicare supplement and your Medicare are not covering your drug coverage. So we've got to have a Part D plan so that you don't receive a penalty, as well as, and by the way, when you get a penalty, that stays with you for your entire life. So we need to avoid it from the very beginning. And also, we want to make sure that you have drug coverage for when you need it. So these also will be a separate card, separate premium when you're on the red side. These are private insurance companies. These are contracted with Medicare. Okay, these are actually Medicare plans, but they're contracted through a bunch of different insurance companies. Okay, and the way that I determine which one's going to be the best for you is literally your medications, because they will cover them differently that we'll get into in just a moment here.